And I know that is stressful news. In fact, life is pretty stressful in general right now. The CDC put out a report yesterday that 1/3 of Americans have experienced symptoms of anxiety and depression since last April. It gets even worse in Oregon. You see that dark green color over there? About 42% of us are having those same symptoms. And if you ask an expert how to treat those feelings, they're going to give you about 1,000 different options. Medicine, exercise, maybe religion or meditation. And now, I guess in the spirit of 2020, you can add magic mushrooms to that list in Oregon. Initiative Petition 34 will almost certainly be on the November ballot and could allow you to legally use magic mushrooms, or more specifically, the psychedelic compound psilocybin. That's the part that makes you trip or hallucinate. And according to some studies, a whole lot more. I talked to a spokesperson for the group that collected all the signatures to get this on the ballot. Listen here.
I've been involved with progressive drug policy reform for over 10 years here in Oregon, and I have met and worked with a lot of people who are suffering from mental health conditions. And I simply think there are more alternatives, such as psilocybin therapy, that Oregonians deserve access to. And so I really come at this from a healthcare perspective and being able to provide people more opportunities to explore things that might work for them better than what they're trying now.
There have been lots of studies on the effects of psilocybin over the years. I would say maybe the most heavily referenced study by anyone trying to advocate for this type of therapy was a study out of Johns Hopkins. They tested the effects of a controlled dose on 15 people who were addicted to cigarettes. And when they checked back 6 months after the one dose, 12 of them had quit that very day and hadn't smoked since. That's an 80% success rate. Vox actually interviewed one of the people from that study. Here's a little clip we'll show you. And keep in mind, the video editing definitely matches the tone of the interview.
It was the most peaceful, joyous, incredible, life-changing experience I've ever had in my life. There were scary parts, foreboding parts. I always knew there was beautiful and joy and peace on the other side of it. It was freeing.
You can find tons of various studies online and interviews with people like that. Some say psilocybin can cure anxiety and OCD. The New Yorker talked to a man who says the drug helped him accept his death after a terminal cancer diagnosis.
I don't think I've ever experienced, ever, the gratitude that I felt. And gratitude for what? It was just gratitude. I don't like to talk about it because it's really beyond words.
Now, as interesting and possibly as promising as all that sounds, these studies all suffer from very small sample sizes, and that invites doubt into their findings. I talked to Dr. Chris Stauffer today, who worked on a psilocybin study in the Bay Area at UC San Francisco, which was operating at the time under FDA guidelines, which is new. He says if we pass this bill in Oregon, it would bypass the FDA altogether.
But what are some of the risks of bypassing their approval procedure to kind of fast track something like this?
Well, I think we wouldn't have the solid safety data that we would have if we went through the FDA. To conduct an FDA phase 2 or phase 3 clinical trial takes a lot of effort, a lot of people, a lot of paperwork, and everything is scrutinized. So every tiny thing that could be an adverse event is documented and investigated, and we wouldn't necessarily have that.
Instead, Oregon's magic mushroom bill would include a 2-year development period. And in that time, the OHA and an advisory board appointed by the governor would work with experts and try and kind of fine-tune exactly what this would look like, what the process would be. And they hope that steps like that will overcome the stigma associated with psychedelics.
Stigma is tackled through education. It's plain and simple. And we know from our polling research that shows when we are able to educate Oregon voters on what psilocybin is, who stands to benefit from psilocybin, and what the research is showing, we know that Oregonians are with us.
Now, you may have noticed I wasn't exactly clear at the beginning on whether this would exactly be on the ballot, saying that it was all but certain. So you need 112,020 signatures to get something on the ballot. The group turned in 135,000 in May, and the state then authorized 106,000, leaving them about 6,000 short. But they then turned in an additional 31,000 new signatures and believe that out of that number, they will get enough valid ones to, in fact, be on the ballot.